everybody, I'm going to show you how to wipe down and set up your op. We want to make sure we do this every time before a patient comes in between patients, make sure that we are providing them a safe place to have their teeth cleaned. The first thing that we always start off with is filling our water bottles. So I'll just come over here and grab our water bottle over here, and you want to make sure that your system is off before you take it off, and you just turn and pull down, and then you come over here, and this should be filled, so we want to make sure that we fill it after we use it also. You just fill it with the water and use 2 of these blue tabs that are up here in the cupboard, and then you just fill up your water bottle. This fills 2 bottles, so you'll just use half of the gallon jug here, and then fill up your water. And then, without touching the hose, oh my gosh, then you're gonna put it on, and twist it, and then you'll come over here and turn on your power. I'm just gonna show for sake, but you'll turn on the power, and then you'll bring your water syringes over to your suction, turn on your suction, and then run the water for 2 minutes. And we want to do that for each time that we're setting up in between patients. So that makes sure our water lines are clean. And then from there, we're going to go ahead and wipe down and set up. So you come over here, we have our gauze strips, and we have our Bi-Rest and our sanding cloth, and those are all just found under here. So we just start with the Bi-Rest. This is good to loosen up the debris. We do a wipe down first with that, and then we do a second wipe down with our sanding cloth. And I kind of like to open them up so they cover my hand. Makes it a little bit easier. And then you come over here, and I just start in a same kind of circle. So I go around the outside and work in, and you just spray down. You want to make sure to spray down the countertops and the cabinets, and then do it on the chair. I'll do everything surrounding the chair, and I'll wipe with the wipes on the light. We just want to make sure not to use it on the chair because the fabric can't be used with the Bi-Rest. And if these get soiled, which mine is starting to get dirty, you can change out your little 4x4s. Okay, so I already sprayed everything around here, and I'm coming here to our chair. Just going to show you how I wipe down the cords. We want to make sure that we're wiping from the back of the cord up to the front and around. Just make sure that we're not pushing anything that's up here back onto the back of the cord. That whole process that I just did, I repeat the same thing with the SaniCloth, and that makes sure it's sanitized. I want to make sure that I get the light, make sure to get your handles and the whole arm. And then also with our new mirrors here, we want to make sure that we get that whole cord and then wipe off the mirror. And then you want to make sure that you wipe it off with a towel with water afterwards so it doesn't have spots. We want to make sure with the SaniCloth we also wipe down our x-ray tube head and then our x-ray machine over here. Make sure to wipe the cord and the handle and the face with the SaniCloth. And then we just want to make sure to also get our chair, our op chair, and as well as our keyboard and mouse and their cords. For our setup, we're going to make sure to change our gloves, sanitize our hands, make sure they're dry. Take our burrito, take off our little band. I like to set it over here on our little cart and kind of roll everything out. This is for your keyboard. So what I usually do is I bring the keyboard forward and I fold it over. That way you can just fold it back when you're ready to use the keyboard. And then you want to set up your syringe.
It's backwards.
Yeah, backwards to mine. Okay, so you can put your suction there. I use this air water syringe on this side. Set it here. And then I'll show you. So we have our bags to cover our chair. You cover here. This is the sound here in clinic every morning. So you just want to make sure to cover your chair. And the cords of what you're not going to be using. And on this side. Okay. There we go. So you have your biohazard bag. It just goes on the side of your tray. It's there for when you have extra soaked gauze that needs to go in biohazard. I just stick the sticker on the side of the bag. And then if you can kind of get it in the groove underneath it, hopefully stays. And then a bib goes here on the tray where your instruments will go. Thank you. Okay, so then a bib goes here. One is for your patient. I set the gauze up here. So then you also want these covers. One will go, these can just be found in your drawer. I just usually set it like this with the tip where it'll go through, so I don't uncover it until the patient's there when I'm ready to use it, but you just want to make sure that little slit's by the air water syringe ready to go. Makes it a little bit faster. And then I do two on the light handles. If you don't have this type of light, you can also use the slap wrap tape to cover the handles. And then if you just leave it like that, it's covered until your patient comes. And then with the slap wrap, I just get the sides where you'll be grabbing your rolling cart. And then I make sure to get the mounts that I'll be using. And you just cover that good. And then I also put it on my chair. So I'll just show you. If it's this chair, this is the one I use. I covered the back and then the adjustment handle. And then to set up the x-ray machine, put one on the arm because I'm gonna be touching the arm, so I'll put one here. And then put over here. Slap wrap on the face. I won't use too much. I'll put slap wrap on the face. And then there's also, you can put one of those sleeves over the handle. So you'll want to make sure those are on there. And then also on the switch. And then another thing to remember with the tube head is to put one of our bags. There's usually bags up in this cupboard. They're like a small garbage. Oh, we have one. A small garbage bag. And you just put it over the tube head. So that's set. And then usually you'll just get your instruments, you'll put them up here on the tray, and your op will be set up ready to go. Make sure to have your bib clip, and then I usually just clip it right here to our back of the chair and it's ready to go for a patient. Awesome.
Hi, I'm going to teach you guys how to take everything down after your patient has left. I just have my same gloves after treating them. So the first thing you do is you just fold this down. And then just gather everything up, your bibs, all the slap wrap. Everything from your counter. Be careful not to touch anything so you don't contaminate anything that's not been used. And make sure when you pull these off, sometimes this part will come off with it. So be careful to check that this stays on there. And if it comes off, put it back on. And with these mirrors, there is optional, you can slap wrap before you start with your patient. Or if you choose not to put slap wrap, take the whole thing off, wipe down the whole cord, change your gloves, and then put it back on with clean gloves. And our X-ray machine. If there's slap wrap on the X-ray machine, make sure you take that off and wipe it down. Everything. And tie up our bag. And throw it away. And you want to make sure you change your gloves. Just like in the previous video, you wipe down. We only use the BioRest to prep. So you'll change your gloves so you have clean gloves on, and then you wipe everything down with the Santa Claus.